Today I'm going to talk about valvular heart disease, in particular mitral stenosis. When we think of valvular heart disease, there are two broad terms: stenosis, when the openings are narrowed, and regurgitation, when blood flows back through the valve. Mitral stenosis is narrowing of the mitral valve. It is seen in the age group 40 to 50 years. The most common cause is rheumatic fever. In fact, 95% of all cases of mitral stenosis are caused by rheumatic fever. The other 5% of causes include amyloidosis, lupus, and rheumatoid arthritis, amongst others. The mitral valve is located between the left atrium and the left ventricle. In mitral stenosis, there is narrowing, and this reduces the flow from the left atrium to the left ventricle. This leads to more pressure within the left atrium. Consequently, this will lead to congestion in the pulmonary circulation. This is due to the backward transmission of this pressure. So, in essence, more pressure in the left atrium will lead to more pressure in the pulmonary circulation. The pooling of blood in the left atrium will cause atrial dilatation. This will predispose to AF and thromboembolism. There are many signs of mitral stenosis. First of all, the patient will have a low volume pulse. This is due to low cardiac output. This is because blood is not going from the left atrium to the left ventricle. Secondly, the patient is more likely to have AF. This is due to blood pooling in the left atrium. Thirdly, the patient may have a loud first heart sound. This is likely due to the increased pressure difference between the left atrium and the left ventricle. The patient may also have an opening snap. Finally, there will be a rumbling mid-diastolic murmur. This occurs as the left atrium will contract in diastole, and henceforth we get a mid-diastolic murmur. Is there any way you can tell how severe the murmur of mitral stenosis is? Well, the longer the murmur, i.e. the longer the rumbling mid-diastolic murmur, the longer time it takes for the atrium to empty and contract during diastole. This indicates a greater severity. What investigations might we do? Well, we would do an ECG, a chest X-ray, and an echo. We often do these in all valvular conditions. What is the treatment? If in AF, they should be anticoagulated, and there should be relief of symptoms like breathlessness. Beta blockers can lower the heart rate and increase cardiac output. The surgical treatment is known as PMBC, and this will dilate the opening. It is the first line treatment. A rule for stenosis is to remember there will always be hypertrophy. In mitral stenosis, it is left atrial hypertrophy, whilst in aortic stenosis, it is left ventricular hypertrophy. When describing a valve for your exams, when describing a murmur for your exam, it is best to go through the different parameters. The location. In mitral stenosis, it will be best heard at the apex. In terms of radiation, mitral stenosis moves to the axilla. Timing. It is a mid-diastolic murmur with a low pitch. The pitch indicates the speed. Maneuvers. It is best heard when a patient rolls onto their left side, and it is best heard on end expiration. Thank you for listening. Please don't forget to like if you enjoyed this video, and please subscribe to see more medical videos. Thank you.